In this video, I'm going to review the forced countback feature in Cubex. In Cubex, there are three types of countback: regular countback, blind countback, and forced countback. Regular countback and blind countback are optional and featured in another Cubex video. Forced countback is end-of-bottle management for container-tracked items, usually controlled substances. Let's first take a look at a regular issue screen for buprenorphine. The patient and owner information is shown here, the quantity to be issued is shown here, and there is only one column to enter a quantity on this screen. The amount needed is entered here, then the QB is closed, the drawer is closed, and then you select Next. Now let's look at a forced countback screen next to it. Immediately you will notice the yellow banner at the bottom of the screen. This banner lets you know that you are emptying a container and that a countback is required. As you can see, Cubex thinks there is only 0.25 ml left in the open container. Because 0.25 is less than what is needed for the patient, the forced countback screen is triggered. Just as in the previous screen, the patient and owner information is shown here, the quantity to be issued is shown here, and the difference is that this time you can see both the countback column and the quantity column. Let's look at this close up. The countback field is what you find, and the quantity field is what you take. The amount left in the open container is drawn up and measured. It then needs to get recorded here. When you change the on-hand quantity of an item in Cubex, you are creating a discrepancy. While DIs are usually viewed as a negative thing, in this case it is necessary to keep the counts of both bottles correct. Then the remainder of the dose is then taken from the next file and the quantity is entered here. As a double check, you can hit Update Totals to make sure the quantity seen in the Quantity Dose Entered box matches the quantity in the Quantity to be Issued box. Then the QB is closed, the drawer is closed, and you select Next. This screen is the confirmation screen showing that the patient did receive 1 ml of buprenorphine. At this point, the user can exit or go back home and perform another transaction.